So again, we know that children and teens at home have a different response to stress. Not all children and teens respond the same way, but here's some of the common changes for you to look. Here's some of the common changes to look at. So in children and teens, maybe there's excessive crying or irritation. Younger children are more irritable. That maybe there is a regression or return to behaviors that they've outgrown. Maybe there is this pervasive sort of worrying or sadness or needing reassurance from their parents or caregivers. That with the disruption to their routine, their schooling, disruptions to your routine, the world, that there might be sort of this unhealthy eating habits or maybe changes in sleep. And in teens, we see irritability and sort of acting out behaviors. They sort of take it out, their frustrations outwards, and they act out in ways that are unusual for them. And those are some of the signs that children and teens might be reacting to the stress. The other changes that we might see is decreased in school performance or avoiding school. And I know that most people have moved to sort of the online school, but maybe it is avoiding signing on or doing the work or connecting during the video conferencing. That you see a decrease in their ability to pay attention or concentration, and maybe things that they enjoyed doing in the past, they just have lost interest in. For a lot of kids and teens, the way that they express their upset is through body symptoms and signs, so headaches or body pain. Those can be indications of stress and emotional disruption. And then we also see some uncharacteristic impulsive acts, unusual things that they normally wouldn't do. So what can you do to support your kids and your teens, your family during such time? Is talk about an age level appropriate amount of information about COVID-19. Remember that they are passive absorbers of the news on TV and on the social media that you might be tuned into, and they are going to pick up on those stresses. And one interesting fact came out of 9/11, that when they looked at children who watched the news about the planes that hit the Twin Towers, when you asked children what happened, they reported that thousands of planes crashed into buildings because they were not able to distinguish between the repetitive repeat of that image and it being a unique situation. But did you also know out of that came some research about adults, that while we know that we're watching a repeated event over and over again, our brain actually accumulates those, not to a one-to-one ratio, but it does accumulate those events, and it can really forget that every time you watch the news story, it is the same news repetitively stated, but that it actually seems accumulative. With kids or teens, we want to ask questions and share facts that are age appropriate, that they can understand. And there are resources through the World Health Organization that actually are presented and made for children of certain ages and teens of certain ages. So access those. Don't make it up as you go. There's already places that you can go that have the fact sheets available in age appropriate language. Stress in kids and teens usually has to do with their safety. So reassure them that they are safe. Make sure that they understand the risk associated in real terms, but not in necessarily those over-exaggerated terms of either your health, their health, or people dying around them that they care about. Let them know it's okay, give them permission to be upset, and share with them how you deal with your own stress so they can learn from it. After all, that's what adults in children's lives are for. It's to model the behavior. So if you model the good and healthy coping strategies, they will learn from you and cope better with their own stress. What can we do to help our families get through this? as I said, I can't underestimate exposure to news and social media. Limit it. Set it to once a day, and that children will misinterpret what they hear. So they might be in the background while you're talking on the phone or while you're watching news, but they will pick it up, and it can cause them to be frightened about something that they don't understand. We are creatures of habit. We love routines. And when routines get disrupted, stress levels go up. So if you can establish a new routine with schools being closed, with activities being curtailed or stopped, find a new routine, wake up time, bed times, touch points during the day that become certain, and be that role model and connect with your family and your friends, even if at a distance.
A quick comment, because I do have a teenager who's I think one of his biggest challenges being seeing his other friends out there not following social isolation protocols, and they're out getting to see. And so this was weeks ago, trying to have that conversation about why we're doing what we're doing. So he's now become my biggest advocate, and he's one that tells me when it's time to go to bed, so I'm not staying up too late. So he's taking care of me, making sure I'm getting my sleep. But it's an interesting thing when he gets different reports. So I think having an open opportunity for them to ask whatever questions, no matter how silly or whatever they might be, is finding time for them. So that's definitely probably my biggest strategy, making sure he has the chance to ask the questions he needs to. So
I think also some parents put the responsibility that they have to have the perfect answer for that child, or they have to have the answer, and they're afraid of opening up that conversation. But here's the thing, sometimes what you can do is find the answer together on reputable sites like the World Health Organization, on the CDC, on the government websites, and that you help them find the information even if you don't have it firsthand, and it's not being afraid to not have the answer, but the willingness to find it with them. And most parents, they're afraid of having the conversation because they don't know what to say, or they don't know, just know where to go and get it. Any other questions or comments?
Jeff, even just to touch on even parents at home that are single parents that are looking after kids, an increased stress and having to say come to work and deal with that. And even maybe if you could even touch on even partners who are both in the healthcare field, with both dealing with that stress at work. I feel like that can even add even a little bit more dynamic into the household.
Yeah, I think that the key is the communication and the openness. And I think that if you are two adults sharing your concerns, you want to make sure that your children may not be witness to it, but what they actually are involved in is the discussion about sort of what's being put in place to help the family cope. And again, as a single parent, you don't want to put that burden onto your child, but you want to reassure them. And despite the fact that you might be fearful, that you might feel stressed, as much as you can, use another adult as your support. Don't use your child, which is, again, common sense. Most people would know that. But talk to them with the plan to get through this together, and make sure that you have the access to supports for the children when you're not there. Do they know who to call? Do they know what's available to them? Even if they don't feel like they want to put that burden on you, and again, depending on the age of the child, do they know where they can call and who to talk to and who their go-to is? So I think it really is just have the conversation, but don't have it in the preliminary stages where you as the adult are trying to figure things out. You need to have the conversation when you have got a plan in place, and it doesn't have to be perfect. And the nice thing about kids is generally they will trust you to help them get through this. And so don't let your anxiety pass on to your kids. That would be my number one. And if you need help with that, that would be something that I would really encourage, that you reach out to those more formal supports that can help you come up with that plan, come up with that strategy, and involve your child either as a single parent or, again, as a two parents working in the same field. Reach out to those contacts and supports to help your family unit through it.